everyone, Dr. Elena here, actually from my office. We are live, so if I mess up, so sorry. But we just want to do a really quick update about Texas opened up. I think we all know about COVID-19 by now. Everyone's has significant quarantine fatigue. So by now you've probably ventured out to an outdoor restaurant, which is what my family's done, or you've at least been able to go somewhere. Lots of walks. Lots of playing with the kids, but at the same time, these kids want to go to camp, and a lot of you had already signed up for your children to go away to summer camp, and my youngest goes to Camp Longhorn, and so we've been following this along during the spring when all this started to see, are they still going to go to camp or not? And so it looks like camps are starting, and so we just wanted to give you a quick update about that because we've already had parents calling because they want the kids to go ahead and get either COVID testing or they want to have some sort of assurance that the children aren't sick before they arrive at the camp. And that's pretty important because, you know, these kids are going to be now bunking together in like dormitory style living, and we'll get to that in a minute. So we will put the link on the website, but what I have is my notes here, which are 6 pages worth actually, and these are the minimum standard health protocols. And I think I would really underline the word minimum standard health protocols for overnight camps in the state of Texas. So you can find this on the web. This one was revised on June 3rd, so it's very recent. And it was really May 31st that Governor Abbott said that camps could go ahead and start reopening. So I just want to cover a little bit of the information in here. And one of the biggest takeaway points is you really do need to find out whichever camp your child goes to, what they need to have done beforehand. I can tell you Camp Ozark, Camp Longhorn, most of these camps already at baseline before COVID happened required that you already have a health form that's filled out from your physician or having your shot record up to date, and you have to send them all these things beforehand. But now with the coronavirus, there's this extra layer of protection, and so they're going to want to have extra things ahead of time, and that might even include testing. So it's really important to go to whichever camp your child's going to be attending or you're considering attending and look for that information. The other thing that I will tell you already is there's a very likely chance that all these camps won't be full. A lot of parents might choose not to send their kids to camp this year. They also sometimes have restrictions with international travel, so some of these campers actually came from England or they came from somewhere else, and so they can't actually get here, or even they were coming from out of state and they decide not to come. So the likelihood that your actual child's camp will be as full as it was last season is small, but you want to be prepared ahead of time. So back to the very long 6-page form. Okay, so the first page just tells you about COVID-19. I think we're all familiar. The one reassuring thing I'll still tell you from the pediatric standpoint is we have not seen really high level of disease in children. We have not really seen that they're super spreaders, although they are super spreaders of the flu, and we will touch on that at the end. And so in a sense, like the kiddos have done pretty well. We've not seen the mortality rate, of course, nowhere close to that we've seen in the adult population. We still, of course, worry about children, especially if they get infected and then infecting someone else, like an elderly grandparent or someone whose immune system doesn't work. And so we still need to use an abundance of caution. But, you know, as I said when this all started, I still feel strongly that in general the pediatric population has fared well. We did a post earlier where we touched base on the inflammatory condition that they've seen in some of the children after getting coronavirus. And so us as pediatricians in the pediatric community, we know that can happen, and we also know how to treat that. And so we still would, of course, advise you, any fever, any problems with cough, suddenly diarrhea, vomiting, so basically any illness, you know, go ahead and reach out to your healthcare provider to make sure that they are getting, tested if they need to be tested. And plus, since they closed school, most infectious disease in pediatrics kind of went down dramatically. So most kids aren't getting sick. So if they are sick, they actually, they probably should be tested or considered tested. So a few things to point out for the overnight camps. I mean, one of the big changes with my daughter with Camp Longhorn is they got rid of the bus. So the way it used to work is pretty awesome. We drove to Memorial City Mall, and there was all these buses, and then we hugged, and it was kind of an easier separation because they jumped on a bus and they had their friends, and then they all had this, kind of tailgating party over to Camp Longhorn. So the buses no longer for this year, and so instead all the camps are requiring you to bring your child to camp. And the other big difference is that there's no more visiting camp. So when we used to pick up our child, that was like our favorite part, was like we showed up, we called it V-Day for Visitor Day, and we'd show up and they did several of the activities. We got to see the other parents and the other kids and their camp and all their little friends and the counselors, and so they're not going to do that this year across the board with the camps, kind of as mandated from the Texas State Health Department. Things that are also important is before even camp arrives, for the counselors, they're clearly going to be making sure that the counselors aren't having any signs of illness before camp, because they wouldn't want the counselors or any of the staff there to then pass it on, to any of the campers as well. So for their minimum requirement, they said that they would limit staff with underlying conditions from attending or staffing camp sessions. That makes sense because they'd be a vulnerable population. And then strongly consider requiring staff to report to campgrounds and facilities 7 to 10 days before the beginning of camp session. That one's kind of challenging because for a lot of these camps, sometimes it's a new set of counselors for each session, and there's only a day between each session. So, they said strongly consider, so it could be a lot of camps aren't going to be able to do that. But this way, if that counselor came ahead of time for 10 days, they could monitor them for symptoms, and then if they never develop symptoms, then the chances are they can't pass on coronavirus unless they go back out in the community to get possibly reinfected. And then it said, consistent with the actions taken by many employers across the state, consider having all staff wear cloth face coverings. Most of these camps are going to be outdoors, and the one thing we know about risk when it comes to COVID-19 is that it seems that being outdoors is much safer than being indoors in a closed small space. And even if you're in a closed small space, it's probably better to have the windows open. So a lot of the camps don't have air conditioning. I know my daughter's camp does not have air conditioning, and so they only have their windows open anyway. And so for outdoor activities, I think I'll be surprised if I see the camp counselors wearing a mask all day. It is so hot in Texas, and they're outside. And when you're outside, it's really easy to space away 6 feet from each other. So let's consider, so this doesn't look like that it is a requirement that they wear a mask, and the same is true for the children, so not a requirement. They gave them lots of rules for like dining, and then of course they want each camp to have access to a physician, pretty quickly, and access to testing as well. And then of course each camp usually has like a camp nurse and a health area where they could isolate anyone who got sick. It says, to the extent possible, separate campers and staff into groups or cohorts that remain consistent over the time of the camp period. So one of the big changes with camp this year for my daughter is that they're not going to have carnival where all the kids got together. They're not going to have the dance. I don't even think they're going to all go when they would go to chapel or something where all the kids got together and participated in one joint group activity. So instead, they're going to be with pretty much their bunkmates, and those are usually limited anyway. So there might be 10 or 12 kids in a cabin. So I don't know if they'll be limiting that even more. But once they're with that group, it looks like they're going to want that group to stay consistent all throughout. Because then if one of those children ends up sick, they can quickly isolate that group instead of then isolating necessarily the entire camp. It says discourage mixing between groups of cohorts. So that would go back to the probably discouraging having large gatherings like everyone in the dining hall at the same time, or everyone going to chapel all at the same time. It says immediately isolate any camper or staff member who tests positive for COVID-19. That sounds very reasonable, but I think the thing that parents need to be prepared for is the next one. If a camper tests positive for COVID-19, the camper's parent or guardian should pick up or arrange to have picked up the camper within 8 hours. So for those of you whose child goes to Camp Ozark or places that are farther away, they might have different rules because Camp Ozark's not Texas. But at least in the state of Texas, they really want you within 8 hours to be able to, get your child. And I think if anyone's child was suddenly sick, you'd probably want to get them regardless anyway. But just know that going into it, and I know that's what Camp Longhorn had written down in their policy as well. So for me, I already have in my head, if my child ends up sick and they think it's COVID-19 or they test positive there for it, I need to make sure I get someone to go pick her up. When an individual tests positive for COVID-19, notify all parents or guardians of campers in the cohort. So at the bare minimum, if one child in that cabin who's their cohort becomes positive, then they want to notify all the parents, because say you're about to end camp and you have one child who's positive and the other ones don't have symptoms yet, but they haven't been tested, and then they end up positive later, but by then they've gone to grandmother's house and then potentially infected grandmother. And we know that grandparents are a very vulnerable population, and they're a group of people who really want to see their grandkids. So the other thing they strongly suggested is that for the 14 days after camp, for them to avoid vulnerable populations. So quarantine if they can, which I think at this point is really difficult, but at least stay away from vulnerable populations like grandparents. And of course, at any time, if anyone has symptoms, you should be self-isolating anyway and getting appropriate testing and treatment. Now, health protocols limiting access to the campgrounds and facilities. This is another one that's a really big change. So no parents or guardians visiting the camp during or between the camp sessions, except to drop off and pick up the campers. And they want them to modify camper drop-off to keep the parents and guardians from coming within 6 feet of people who aren't in their family. And so staggering drop-off times might be one way they get around that. And then they said, if possible, the parent or guardian should remain in their vehicle at camper drop-off and pick up. And so for us, I believe ours is kind of a drive-in. They're going to check your child's temp most likely. They're going to look over the paperwork. I'm sure they'll be wearing a mask. Your child will get out of the car. They will take their luggage out of the car or their big trunk. And then I'm sure they have a protocol for getting it to their cabin. The good news is maybe you're off the hook for dragging that trunk from the cabin back to your car, which always, if you didn't put wheels on that trunk, was kind of challenging. So that part's a big change, and like I said, no visiting. And I'm pretty sure going and picking up your camper to go do another activity off campus or off the campgrounds and coming back is probably not going to be allowed either. So for example, sometimes kids have cheer camp in the middle of regular camp, and their parent just says, hey, I need the kid for a couple days, I'll bring them back. I don't think they're going to let you do that. I'll probably have to break that news to my daughter soon, actually. It says no visit, and once again, no visitors to the camp unless it's someone like food delivery, but no regular visits to the camp, and they should be using social distancing measures. It says once staff has arrived at camp, they should really be restricted from traveling into the surrounding communities as much as possible. And they said weekly supervised trips to stores for essential goods while wearing masks should be allowed. Okay. Now, as far as what they're going to do at the camp, my guess and what the minimum standard is that at least daily while at camp, all staff and campers will be screened for any new or worsening signs of possible COVID-19, including having their temperatures taken. And then they need to have access to on-site medical personnel or an on-call physician for the entire camp session. And then, of course, on initial arrival to camp, they're going to have to screen all campers and staff to make sure that they don't have COVID-19. So for Camp Longhorn, there's a special form, and this is why you need to go to your specific camp and look to see what forms to fill out, because whatever forms to fill out always becomes my form to fill out, and everyone waits to the last minute every time. I promise this happens. But on those forms, there's a new form, and it was about COVID-19 for at least our camp, and it specifically said, for 14 days, you check this box if you've been self-quarantining for 14 days before camp. If you haven't self-quarantined for the 14 days before camp, they want you to get a COVID-19 PCR test. So that's very important, because at this point, most people are no longer completely quarantining in their home. So that kind of means pretty much everyone going to camp probably should have that PCR test. Once you have the test done, they want you to quarantine from the time you take the test till you arrive at the camp. So the test can take several days to come back. It depends on the volume of the test in the city. And so keep that in mind. If you try to do this at the very, very last minute, you will be disappointed. You may not get the test back in time, and your child might not be able to go to camp. So if your camp is requiring a COVID test, really pay attention and make sure you get it done in time, and then being cognizant of what rules they're putting forth, because they're really doing that to keep all the campers safe, because they want camp to go on the rest of the summer. And so we need everyone to like work together so that everyone can go to camp. Now, consistent with actions around the world, it says, if available, staffers and campers should consider wearing non-medical grade face masks. Once again, most of these camps are outside. They're going like water skiing and, you know, pool and all this sort of stuff. I don't see that happening. Maybe when they're inside, if they have to, you know, go to the health clinic or something like that. But it says should consider, so it's not required. Now, as far as lunch, even my daughter mentioned that dinner and lunch was different now. So it used to be kind of buffet style, and they all went in there together. So now they want no self-serve buffet meals. And let me just say for the record now, if nothing else happens from COVID-19, the idea of getting rid of self-serve a buffet is not a bad idea in general when it comes to the spreading of other diseases. So for the kids, no self-serve buffet meals should be at the camp, and serve meals with disposable utensils, napkins, cups, and plates. So they used to just have a tray and, you know, and they'd wash their plates, and apparently we'll protect the environment later. But for now, they want them to use disposable, all disposable. And then they want them to clean and disinfect the tables, chairs, etc. after use, which is, of course, is very reasonable. As far as in the actual camp room itself, like in their bunks, they want the bunks to be sleeping head to toe. So one bunk up here, the kiddos' heads here, and the other bunk, the kiddos' heads here. So that does give you 6 feet away, and they want you to put the bunks 6 feet away from each other as well, which is actually pretty difficult. They encourage open windows and fans, and then they said personal fans. This is very important for my daughter because it's so hot, and they all bring a personal fan, but it said it should be only pointed at one camper. So if you bring your own fan, it's for you. It's not for your friend, apparently. As far as if they take excursion away from camp, I think almost all camps are going to just try not to do that at all, because they want them to stagger seating for maximum distance, and they want them to wear a face covering while in the vehicle, at least asking them to do so. So I think most camps are just probably not going to be doing much of that. They, of course, want them to deep clean and sanitize the camp prior to the start of camp, and then remind campers, parents, guardians, the enhanced risk of campers being in direct contact with anyone 65 or older, I would say, or whose immune system is compromised, for 14 days after the end of the camp session. Some of these kids, they're going straight from camp to school. So it kind of is what it is. Okay, so like I said, make sure your particular camp, you know what form you need to fill out. Make sure you know if they need to be COVID tested or not. We do, for our patients, COVID testing in the office. We don't have the rapid one at this time because it's not certified for medical offices, but we can send the PCR, which is a nasal swab, to the lab, and we get them back usually in a few days. And then we, of course, have antibody testing available as well, but the antibody testing really only shows you past infection, like an IgG test. It doesn't show you that you actively have it. And so, and at this point, we're still in this debate mode as to whether or not we'll have immunity for people who already got infected anyway. So PCR is really the only testing that they're going to accept. They won't accept antibody testing for that. Now, the only other thing I want to touch on, so that's camp, is what happens after camp, because there's something called school. And as we all learned, most of us are terrible homeschool teachers, and so now we realize how important the school system is, and teaching and Zoom is difficult with a bunch of kids. So the winter outlook for school, from my standpoint, as far as I can tell, school will start. I don't know what day it'll start. I don't know if it's going to start earlier than usual. I think there's the HIC is kind of throwing around what they're going to do, and then each school district will do their own thing. Private schools might follow HISD or KDISD, or I don't know. So everyone's following their own kind of set of rules. So we don't really have a general consensus statement yet. Colleges are the same way. And so we don't know yet exactly. All the colleges are starting to come out to say what their plan is for the fall, because they have to integrate a student body and figure out what to do if someone gets positive, because no one wants to have a cluster. I think every school right now, their biggest fear is having them being the ones on the news with a cluster and then causing other people to get sick, which is reasonable. what we anticipate as school will start, I think if I were having young children, in my head, I'd already wrapped my head around the idea that if we have a second wave in the fall, which is what they predict will happen, if our flu season is heavy and the little kids in school are the actual super spreaders of the flu, once our flu season starts to rise, usually December, January, February is when it peaks and then starts to come back down, the ICU beds even in our city are pretty saturated. And if you try to add COVID on top of that, plus RSV, plus rhinovirus, plus all the other viruses they get in the winter, then now you do have a ICU system that's overwhelmed, and that's what they need to avoid. And they don't want to lock everything down again. So if your child's sick, obviously stay home. I mean, I don't think they'll have zero tolerance for anyone who might be sick at school. So have plans in place now for that. And then a lot of the colleges are already starting to come forth and say, hey, once Thanksgiving hits, don't come back. And then they'll have them come back for the second semester. And even that will be like, we'll have to see how things go, because if we really have a second surge, we'll have to not, have so much spread. And when people go away for Thanksgiving and travel, when they come back, that's when our flu season really takes off. And so even the regular school system might say, hey, maybe we need to cut this short and do online learning for, the heaviest months of the winter season, just so we get past this. And, so we're going to have to wait. We're going to have to, it's all speculation. We're going to have to wait and see. All we know is we need to control the flu season, get your flu vaccine. Some people don't get them, but it's the only thing we really have against the flu at this time. And then, of course, lots of natural vitamin D, which you're getting lots of right now because it's nice out. If you have any questions, feel free to comment, leave them below. Feel free to reach out to your pediatrician as well. Or if you're in our practice, of course, reach out to us. Everyone stay safe. Everyone have fun. We still would encourage you to space out a little bit and wear a mask when you're inside at places that you don't live at. And have a great day. All right. Bye.